Is urging travelers to be cautious about the outbreak of a bug-transmitted disease. Some countries are reporting their first ever cases of Oropouche. CTV's Scott Hurst is standing by with the latest. Scott, I think a lot of people may be forgiven if they've never heard of this disease. What is it, and why has it prompted a travel advisory?
Yeah, Marcia, this is something a lot of Canadians likely haven't heard of, but the Canadian government has now updated its notice about Oropouche virus, advising Canadians to at least be aware of it if traveling to certain locations in Central and South America, as there have now been several travel-related cases of OVD reported internationally. While it's not a new virus, this year the number of cases is higher than expected, and cases are being reported in some areas of Brazil, Bolivia, and Cuba, where they haven't been before. In June, Cuba reported its first confirmed Oropouche case, and according to the WHO, it's been reported in those three countries, plus Colombia and Peru. The disease is transmitted through insect bites. The symptoms usually start 3 to 8 days after the bite, and symptoms include fever, severe headache, vomiting, and dizziness. There's no specific treatment for OVD, but medical treatment, if needed, could control the symptoms and help in the recovery. So as I mentioned, there are now several travel-related cases of OVD reported internationally. Marcia, at this time, there's no evidence that it's spreading, but the majority of the cases were from travelers who returned from Cuba, which, of course, is a very popular destination with Canadian travelers.
Okay, so what are the symptoms?
So travelers should be aware of the symptoms and also things to do to potentially avoid it. The symptoms include fever, severe headache, vomiting, and dizziness. And in order to do the best to avoid even contracting the virus and dealing with these symptoms, the best advice is to practice specific health precautions, including doing whatever is necessary to avoid the insect bite altogether, proper hand washing, and being up to date on all recommended vaccinations. However, there is no specific vaccine to prevent OVD, so travelers could also be advised to visit a healthcare provider before their trip or a travel health clinic, and after your trip, Marcia, continue to watch out for any of those symptoms.
Okay, Scott, thanks for that. Appreciate it. Scott Hurst for us. Well, there's less than a week.